Hello and welcome. Today we've got Dr. Jennifer Zellers, an assistant professor and director of the Tendon Research Lab in the Program of Physical Therapy and the Department of Orthopaedic Surgery at Washington University School of Medicine in St. Louis. She's a former ballet dancer who has moved into exploring theater on a journey that has taken her into wire walking and aerial silks. So welcome and thank you so much for joining me.
Thanks so much for having me.
Awesome. Well, let's start off by exploring your journey into tendon research. What got you curious in the first place, and what's exciting for you now about it?
So I started on this journey as a ballet dancer, really excited about the foot and ankle. And so once I finished dancing, I transitioned into being a physical therapist.
Mhm.
And so I worked clinically for a little while, but I always really wanted to get back into exploring the foot and ankle. And so the stars kind of aligned. I ended up doing my PhD at the University of Delaware in a lab that studied Achilles tendons. And that's really where I caught the tendon bug. And what keeps me coming back to tendons, I just find them fascinating. I think over the last 15, 20 years or so, the way that we've conceptualized the tendons' ability to be biologically active, its
Mhm.
ability and capacity to heal, has really shifted. And I find that to be a very exciting place to work and push forward the science. So that's why tendons for me.
That's so great because, I have graduated within that time span, closer to that further end, and and I'm just really excited to get to hear more about what's changed and I try to keep up with stuff, but I'm really excited to get to learn from you a little bit more. So, why should I be excited? What do tendons have to do with circus arts?
So, tendons are a big problem for circus artists. And so I think it's really important for us to, take time to know how to best manage tendon problems. I think there's the circus artists who are doing a lot with their upper bodies. And so there's a lot of shoulder and elbow tendinopathies. And then there's circus artists who are doing a lot of jumping and landing and acrobatics. And so that kind of captures the lower extremity tendinopathies. And there's some nuances between those tendons. And I think sometimes we can kind of um, misapply some of the literature, some of the science that's coming out from, that perhaps is studying the lower extremity, and we try to apply it to the upper or vice versa. And so I think it's an important chance for us to kind of sit down and talk about general tendon healing concepts,
Mhm.
but then also talk about some of the nuances that might really make a difference in the delivery of tendon care to people who have these different job requirements.
So this might get a little bit into what is going to be our next question, but so what you're saying is a tendon's not just a tendon. It matters what it's attached to
A
and how we
tendon is
use it.
not just a tendon, and it matters what's attached to, and it matters too what's around it. So
Interesting.
tendons that are curving around bony things are going to behave
Hmm.
differently than tendons that aren't, and tendons that are around a bunch of neural structures are going to behave or have different considerations than tendons that aren't. And so, not all tendons are created equal. They have their individual nuances that are important in delivering care.
When you say it like that, it's like, oh, yeah, of course. But a tendon's a tendon. And like my brain is still trying to like grasp both these things. Like, oh, yes, of course, how it functions and what's near it and how it rubs on things and moves and its life experience matters. Amazing. Okay, so in the clinician hat that you wear, what might be one of the overlooked factors or most important thing that we need to know about when it comes to tendon rehab that other clinicians might miss that may prevent a circus artist from hitting their rehab goals?
So I think there's two big things
Yeah.
that I think about in response to this question. And the first is the tendon is not just a tendon, but we just talked about it. Um,
I got
so
excited. I had to know.
so there's that. The other piece that I think is really important is when we think about tendon loading, a lot of times when we're doing treatment, we're thinking about kind of modulating those loads so that the tendon has just the right input to know how to heal,
Mhm.
but not so much input that it ends up exacerbating the injury. And I think sometimes this can result in clinicians giving this advice that people need to stop doing what they're doing. That they need to, take a break, don't do any training for, the next few weeks or months, while we get your pain managed and we get you on this program, and then we'll try and add that back in later. And the literature is more and more showing that it's actually a good thing for people to be able to engage in some of these activities that are important to them and that are important to their professional and personal lives. And oftentimes it does not need to be an all or nothing hard stop. Oftentimes there's ways that we can kind of strategically dose those activities that people like to do, so that we have a just right amount of load where they're still advancing on their program, um, and not making things worse, but
Yeah.
that they're still able to be engaged in the things that are meaningful, and life-bringing, for them to continue to do.
So what you're saying is we shouldn't be telling our circus stars to just stop doing circus.
I think we probably should not be telling our circus artists to just stop doing circus.
Everyone just cheered. Everyone who's listening right now just cheered. Excellent. That's always what we like to hear. Keep doing circus. We can change how you're doing it or what you're doing and maybe
Right.
why.
It's about turning up or down that volume dial,
Yeah.
for different particular activities, so that people can still engage in the things that that are really important to them. Um, and so that those tissues still see some of those loads.
Yeah.
It's an important part for healing.
So it's both a load management strategy that's not just turning off the dial for the tendon and a human management strategy because we're not just a tendon.
Exactly, exactly. Despite what we like to think sometimes, there is a person attached to the
There's a
tendons
person
that we
attached to
need
the
to
tendon.
remember about.
Excellent. Okay, so what if we switch your hats and go to your artist hat? So for an artist or a coach who's listening to this, what's one small shift in perspective or technique or training that they can take away from the work that you do on tendons that might improve their practice or help them prevent this injury cycle in the first place?
So I think the best evidence that we have for preventing tendon injury is strategically loading tendons,
Mhm.
in very controlled ways, um, to be able to have that tendon be exposed to the loads that it needs to be prepared to resist. So I think that there are some things that we can do to help prevent tendon injury. Um, Additionally, I think one of the real challenges with, people in the performing arts, and this goes for dancers and circus performers too, is that there are a lot of aesthetic demands on, these professions. And sometimes that can be a real challenge, when
Mhm.
coming back from tendon injury, especially from things like tendon rupture. And so, um, being able to understand the aesthetic demands of the profession,
Mhm.
um, and understanding some of the treatment decision making that's happening, to be able to kind of adjust our expectations, and be able to situate people in their best chance to get back to performing at their full ability. Um, so I think those are kind of some major take homes.
So, okay, I know you could probably go on about this for probably literally hours, but I'm going to ask you a question about this anyway. So, for a jumping athlete, so for our tumblers or a high level dancer or anyone who's jumping, what might that like load management or load progression look like? Clearly in brief, because I'm again, I know you can go on that forever.
Yeah, so usually tendons are really, really well designed to resist tensile loads. But they're really, really well designed to resist tensile loads, when those loads are given, um, pretty slowly. So we think that when the loads are given slowly, these are very safe loads. And these are important for training and for injury prevention.
Mhm.
So, what injury prevention might look like is doing slow heel rise sorts of things, say for the Achilles tendon, or slow squat sorts of things for the patellar tendon. Um, in addition to that, the activities of circus performing or dancing also involve like a lot of different plyometric sorts of components. And so, as somebody's progressing, say after injury, they're going to be progressing from these very slow, controlled loads up to more, heavier plyos, faster plyos, things that involve direction changes.
Right.
And so as that happens, um, we just need to be kind of cognizant of the time that a tendon needs to heal um, after those loading bouts, which is a little bit longer than, say, a muscle.
Yeah.
So as we
Rest
introduce
and
those,
recovery component too.
yeah, so as we introduce those high level plyos that are, they're fast, they're changing direction, they're seeing incredible amounts of load as, people are
Yeah.
jumping off things that are several feet in the air. Um, those sorts of activities are going to require probably about 48 to 72 hours worth of rest. So the tendon, unlike a muscle where we kind of know we need to rotate arm day and leg day, the tendon really does take quite a bit longer. And so that's an important thing to consider as we figure out people's training regimens coming back from injury.
So tendons take a different amount of recovery time than muscle, right? And keep learning new things. I love this. Thank you for your time. I have one final question because you are going to be speaking at the Circus Science Symposium. Is there one takeaway that you hope people get from that talk? Is it something you've already mentioned today, or is there something else that you're like, well, come to my talk, you're going to hear all about how tendons do the tango? I don't know.
Well, tendons are very important for doing the tango. I think that important take homes are going to be that tendons, while slower to recover than a lot of other musculoskeletal tissues, they do have the capacity to heal. And it's one of the things that I get really excited about as a physical therapist is that part of my job is to help give the tissue the loads that it needs to
Mhm.
recover. And knowing that a tendon is like just needing the right dose of load in order to make that healing trajectory happen. I think that's a really exciting space for me as a PT, and I think that for other healthcare providers and for coaches, for the circus artists themselves, um, empowering people with this understanding of, how do you consider loading as a treatment strategy? I think that's a really exciting place to be. And so that's something that we're going to spend a lot of time talking about.
Awesome. I love it. I love it. I'm very excited to learn more about tendons, to update my knowledge, refresh my knowledge, and come away with some new treatment strategies. So thank you so much. Thank you so
Yeah.
much for chatting today, and we look forward to learning more from you.
Thanks so much for having me.